Let me tell you about a patient named Sarah. Sarah was in her 50s. She came to me anxious about a skin lesion on her leg. She was worried it might be cancer. I took one look and knew immediately it wasn't cancer. It was just a wart. I was reassuring her when something else caught my eye. On her other leg, a mole. It didn't fit with the rest of her skin. It was the ugly duckling. I used my system, A, B, C, D, E, asymmetrical, irregular border, color variation, about 6 millimeters across. And crucially, she said it had appeared just a few months ago. That was enough for me. I referred her urgently to a dermatologist. Within weeks, the mole was removed. Diagnosis: melanoma. Let me give you more concrete examples of how A, B, C, D, E shows up in the real world. Asymmetry. I once saw a patient with a mole that looked like half a circle of chocolate stuck onto their skin. The other half was pale pink. That mismatch was enough to suspect melanoma. Border. Another case. A man had a mole that looked like a continent on a map. Smooth in some places, jagged and indented in others. That irregularity tipped us off. Color. A woman came in with what she thought was a bruise on her thigh. It was actually a melanoma with black, blue, and red mixed together. Diameter. A teenager had a mole larger than a pea. Even though melanoma is rare in the young, its sheer size prompted us to biopsy. It was caught early. Evolving. Perhaps the most striking, a man who said, "Doc, this mole has been changing every month. It was flat, now it's raised. It was brown, now it's black." That change alone told the story. Every doctor who's worked in dermatology has stories like this. So now you know the system. A, B, C, D, E, and the ugly duckling rule. But here's the twist. Even these systems aren't perfect. Melanoma doesn't always play by the rules. Some of the deadliest ones break every guideline. So what do we do then? How do we protect ourselves when the rules fail? The answer comes down to a single word: change. Dermatologists call these chameleons, cancers that hide in plain sight. They can appear under your nails, on your scalp, in your mouth, even in the eye. Yes, you heard that right. Melanoma can grow in your eye. It's rare, but I've had patients who only realized something was wrong when their vision became blurry or distorted. And that's where the A, B, C, D, E, S can fail. Let me tell you about a patient I'll call Michael. He came to me after noticing a mole on his shoulder that had gotten darker. He told me, "Doc, I've had this mole since college. It never bothered me. But my wife kept nagging me because she said it looked different in pictures from last summer. By the time he came in, the mole was already a melanoma. And worse, it had spread to a nearby lymph node." Michael told me later, "If I had come in 6 months earlier, would this have been different? If we'd caught it earlier, surgery alone might have cured him. But now he needed months of immunotherapy." Melanoma is aggressive because it doesn't stay put. Unlike many skin cancers that creep slowly, melanoma cells can break away and travel through the blood or lymphatic system. Here are some sobering facts. If caught in its earliest stage, melanoma survival rates are about 99% at 5 years. But if it spreads to lymph nodes, survival drops to around 65%. And if it spreads to distant organs like the lungs, liver, or brain, survival falls below 30%. That's why doctors stress early detection so much. It's not just about treating a spot on the skin. It's about stopping something that can invade the entire body. Now, while genetics and skin type do play a role, there are proven ways to lower your risk. Sunscreen. Use a broad-spectrum SPF 30 or higher daily, even when it's cloudy. Protective clothing. Hats, sunglasses, long sleeves, especially during peak sun hours. Avoid tanning beds. They are a direct path to skin cancer. Know your family history. If melanoma runs in your family, your risk is higher. Regular skin checks. Both self-checks and professional exams if you're at higher risk. Prevention doesn't eliminate the risk, but it stacks the odds heavily in your favor.